Welcome back to the channel Hair Dose, and today I'm going to explain you factors influencing absorption of the drugs. So starting with the video, let me explain one thing very clearly, that first and foremost is the most important and is the most asked in the exam, and I'm not talking about the exams of your university. As you know that I'm a professional pharmacist and I actually prepare students for their prometric exams. So coming back to the video, pH at the site of administration or absorption. So if a drug is, as you know already, that all the drugs are either weak acid or weak base. So what really happens is, I will cut it very short so that you don't lose interest in my video. Please stay with me till the end of the video so that you know all the things that I have prepared for you in this proper lecture. Anyways, coming to the point, uncharged drug is better. So as you know, the weak acid form, it is actually converted into an anion and a proton. So what happens is, uncharged drug is better because uncharged drug is actually capable enough to transport itself across the membrane, and it is actually very better both in case of weak acid and weak bases. So as you know that base, after bearing a charge and losing a proton over here, converts into a proper base, and weak base drugs are also there. Anyways, just remember one thing, that lower the pKa value, more acidic it will be, and higher the pKa value, more basic the drug will be. So distribution equilibrium is very important, because as the drug is properly distributed in all the places of the body, in all the compartments of the body, then only then we will have the distribution equilibrium. Coming to the second most important thing, the second most important factor that influences the absorption of the drugs is blood flow to this site. Well, as you know that as well perforated organ is, it will be very much better for a drug to be absorbed, and blood flow, as it improves and it is actually gushing through all the tissues and all the muscles and all the organs of the body, it actually is decreasing the concentration gradient. So as the concentration gradient is decreasing, so absorption will be improving. And if an organ is not well perforated and not well supplied with in capillaries, so it will give us less amount of absorption. And this is the second one. It is also important, as it is asked in exam, that which organ is actually giving us least amount of absorption. As you know, the rota caps, which are used for inhalation, and you know, you have seen them in various pharmacies, and those patients who are actually going through asthma are actually using them. The rota caps are not for eating, they are crushed in a device, inhaler, also known as evohaler, and various kinds of other names are also given by different kinds of brand. But in inhaler device, it crushes the capsule, and a rota cap, it is used for delivering that specific drug, and you actually inhale that drug whole in one dose, and it actually goes to your lungs. Tiotropium, you have seen, it is one of the example. So the third most important one is total surface area. As you know that your intestine is actually given a brush like filaments that are actually there, also known as microvilli, and these microvilli are actually capable of absorbing a lot of things from the intestines, and because of these microvilli, the intestines are actually having 1,000 folds more surface area as compared to your stomach. So the surface area is important because microvilli, uh, I will draw the structure over here. It is just like this. So it is also given a capillary system of its own, and the capillary system is actually able to get the drug or anything that is important in your intestine. It gets absorbed over here. So uncharged drug, as I said before, that uncharged drug or uncharged material is better for passing the lipid bilayer membrane, and as in your intestine, these microvilli are finger-like projections, and they are also given with blood vessels as well. So there is good diffusion, a good amount of blood supply is also there. So more amount of drug will be absorbed in your intestine as compared to your stomach. So that was the third one. Coming to the fourth one, and it is contact time. You must have seen in diarrhea that most of the drugs that you take, or in vomiting as well, most of the drugs that you take are actually not well absorbed. So one has to go for intravenous route of administration of the drug, such as metronidazole infusion, flagyl. You must have heard the name. Contact time is very important over here, because if something is moving in your intestine and it isn't given enough time to be contact with the microvilli, I will follow the same example over here as well, because diarrhea is a very common disease and most of us have been through it. So the drugs are actually not well absorbed over here because of the time is not enough for getting it well absorbed in the bloodstream. And other than that as well, contact time is a very important important factor for absorption point of view. Last but not the least is P-glycoprotein. It is a transport molecule. It is a transporter, and what it actually does is it is present all over the body. It is the most present transporter molecule and most expressed one. What it does actually, it expels various kinds of drugs, various kinds of things that are present in the cell out of the cell. It helps with the exo movement of the drug or other molecules as well. So the organ which has more amount of P-glycoprotein transporter, it will have less time for the contact and absorption and getting the drug to actually work what it is intended to do. And subscribe the channel. Thank you so much, my viewers. I love you all, and I hope there is nothing that is furthermore to be discussed in this topic. But if you feel any kind of confusion or anything, any question, you have my number. It is there in the description. You can WhatsApp me if you feel shy while commenting. Just give me a call on WhatsApp and I will answer your question. And if you are looking for one-on-one preparation sessions, just let me know. I will give you all the information that is required for passing your prometric exam, be it DHA, be it MOH, be it HAAD. Let's prepare and prepare well to get you success in your dream of becoming a professional in UAE. See you in the next video. Take care.